Hello and welcome to Healthy Life Channel, where we explore vital topics to keep you well informed and prioritize your well-being. Like this video if you're intrigued by natural health solutions. If you're new here, hit subscribe and enable notifications for our latest updates. In today's video, we'll discuss the 9 lesser-known early signs of dementia and 13 common symptoms you should recognize. Are memory lapses simply part of aging, or could they hint at something more concerning? Have you wondered if dementia can be prevented, and what early signs to watch for? These questions are critical as dementia affects millions globally, yet it's often mistaken as an unavoidable part of aging. In this video, we'll explore what dementia truly entails, the most common types, and the subtle early signs that could signal its onset. We'll also break down the 13 classic symptoms and discuss evidence-based strategies to help maintain brain health. Could early action make a difference? Stay tuned as we uncover the latest treatments and hope for those affected. But first, please give this video a like. The more likes it receives, the more YouTube will distribute it to people who might not have access to doctors or hospitals. Also, share the video with your friends and family. Let's begin. What is dementia, really? Dementia is a set of symptoms that impact memory, language, reasoning, and behavior. It's caused by the deterioration or loss of nerve cells in the brain, which interferes with daily activities and cognitive functions. Importantly, dementia isn't a single disease but an umbrella term for conditions involving significant cognitive decline. While it's more prevalent in older adults, dementia isn't a standard part of aging. It's a serious condition that warrants proper diagnosis and intervention. A common misconception is that dementia is simply an inevitable part of getting older. While age increases the risk, dementia isn't a normal outcome of aging. While mild memory changes, such as forgetting names, can occur naturally, dementia involves a much more substantial decline that disrupts daily life. Therefore, frequent memory lapses or confusion in older adults shouldn't be dismissed as typical aging. Medical evaluation is crucial for identifying or ruling out dementia. 4 major types of dementia. Understanding different types of dementia can improve early detection and guide appropriate treatment. 1. Alzheimer's disease. The most common form, marked by progressive memory loss, language difficulties, and behavioral changes. 2. Vascular dementia. Stemming from brain damage due to issues like strokes, this type often affects thinking and problem-solving. 3. Lewy body dementia. Characterized by cognitive fluctuations, visual hallucinations, and Parkinson-like symptoms. 4. Frontotemporal dementia. Affects personality, behavior, and language more than memory, with prominent changes in social interaction. 9 early signs of dementia you might miss. 1. Struggling with words. Early dementia can manifest as difficulty finding the right words during conversations. Unlike occasional slips, these issues happen more frequently, causing the person to hesitate, use vague language, or substitute inappropriate words. They may also struggle to name everyday objects. This subtle change in communication can worsen over time and is an essential signal for early diagnosis. 2. Changes in senses. Sensory shifts, such as issues with vision, hearing, smell, and taste, can be early signs. Difficulty recognizing faces, judging distances, or hearing conversations in noisy settings can indicate early dementia. Changes in smell and taste may lead to a reduced enjoyment of previously liked foods. These sensory alterations can lower life quality and may be linked to cognitive decline. 3. Loss of motivation for activities. A decreased interest in hobbies, socializing, or even family gatherings could be a signal of dementia, not just depression. This loss of motivation may lead to neglected activities and less engagement in previously enjoyed tasks. 4. Muscle weakness and coordination issues. Particularly in vascular and Lewy body dementia, Early symptoms may include muscle weakness, fatigue, and coordination difficulties. Tasks requiring fine motor skills, like buttoning shirts or using utensils, may become challenging. Frequent falls or balance issues can also occur, indicating potential neurological involvement. 5. Getting lost in familiar places. Spatial disorientation, or getting lost in places a person has long known, is a frequent early sign of dementia. A person with dementia might find themselves struggling to navigate familiar surroundings, such as their neighborhood or their own home. Simple tasks like locating a specific room or remembering the directions to a nearby store can become challenging. This is often due to a reduced ability to create and follow mental maps, which increases anxiety and affects their independence. These difficulties can lead to frustration, especially when they feel unable to do things they've done easily in the past. 6. Sleep disturbances that reveal much more. Changes in sleep patterns can be another early indicator of dementia. A person may experience difficulty falling asleep, wake up frequently during the night, or feel excessively tired during the day. In some cases, they may reverse their natural sleep-wake cycle, a condition known as sundowning, where confusion and agitation peak in the evening and nighttime. Sleep disruptions affect cognitive function and quality of life for both the individual and their caregivers. Effective management of sleep issues becomes vital, as these disturbances can lead to irritability, further cognitive decline, and increased caregiver strain. 7. Hunched posture and difficulty walking. Physical changes, such as a hunched posture, stiff muscles, or a slow and shuffling gait, may indicate early dementia, particularly in forms like Lewy body and vascular dementia. Movements become slower, and even initiating a simple action, like walking, can require more effort. These postural and mobility issues heighten the risk of falls and limit independence. They may be subtle at first but often progress over time, making evaluation by a physical therapist valuable for early intervention. 8. Simple tasks becoming complex. Performing familiar tasks like cooking, paying bills, or operating household appliances can become confusing and challenging. They may struggle to follow the sequence of steps involved in once automatic tasks, leading to mistakes or frustration. The loss of ability to manage daily routines on their own is a notable sign of cognitive decline. Paying attention to this can aid in early diagnosis and help provide the support needed to maintain independence as long as possible. 9. Loss of interest in social interaction. Apathy, or a loss of enthusiasm for previously enjoyable activities, is a frequent early sign of dementia. The person may appear distant or emotionally detached, withdrawing from hobbies and social interactions. This is often mistaken for depression, but unlike depression, apathy in dementia typically lacks the deep sadness often seen in mood disorders. Recognizing this behavior change is important because social engagement positively impacts quality of life and cognitive health. Stay tuned as we delve into the 13 classic symptoms of dementia. Remember to like, share, and subscribe to support our channel and stay informed about your health. 1. Complete disorientation in time and place. Disorientation is a hallmark symptom of dementia. A person may become confused about the date, time, or even season. They might struggle to find their way home from familiar places or forget common routes. This disorientation can lead to anxiety and increase the risk of dangerous situations. Strategies like labels, calendars, and consistent routines help ease the impact of this symptom. 2. Challenges in planning or problem solving. Dementia often impairs a person's ability to plan or solve problems. Tasks that involve steps, like organizing events or handling finances, become difficult. The person may find following a plan or dealing with numbers overwhelming, leading to frustration and the loss of independence. Simplified tasks and supportive assistance can help. 3. Misplacing objects in odd locations. Frequently putting items in strange places, like keys in the refrigerator or food in drawers, is a common symptom. These misplaced items can create confusion, frustration, and accusations of theft. Patience and organizing strategies can be helpful, as well as establishing specific places for essential items. 4. Sudden mood or behavior changes. Rapid shifts in mood, from calmness to irritability or sadness, may occur without clear reason. Sometimes, inappropriate behavior, like sexual disinhibition or aggression, may also manifest. Social withdrawal and apathy are other common changes. These behavioral shifts can be challenging for caregivers and impact relationships, so understanding and managing these symptoms through communication is essential. 5. Urinary or fecal incontinence. In later stages, dementia can affect a person's ability to control their bladder or bowels. Recognizing and managing this incontinence is essential for preserving dignity and preventing hygiene issues. Simple changes, like regular reminders and easy-access clothing, can help manage these sensitive symptoms. 6. Experiencing hallucinations. Visual and auditory hallucinations are possible symptoms, particularly in Lewy body dementia. The person might see people, animals, or objects that aren't there, or hear voices. While distressing, it's important to validate their experience and respond calmly without confrontation. Medication and redirection techniques can also be helpful in certain cases. 7. Problems with short-term memory. People with dementia often struggle to retain recent information, forgetting conversations, appointments, or recent events, though their long-term memory may initially remain intact. This leads to repeated questions and stories, often causing frustration and dependency on others. Written reminders and photos can be supportive tools to manage memory challenges. 8. Social isolation and withdrawal. Dementia can lead to increased isolation as the person feels less comfortable in social settings or loses interest in socializing. They may withdraw from activities they previously enjoyed. The stigma surrounding dementia can further contribute to this isolation, which negatively impacts both emotional and cognitive health. Encouraging involvement in supportive, adapted activities can be beneficial in reducing isolation. 9. Exhibiting inappropriate behavior. People with dementia may sometimes display behaviors that seem socially inappropriate or out of character. Known as disinhibition, these behaviors can include saying or doing things that may seem inappropriate in public, including impulsive or unexpected actions. In some cases, inappropriate sexual behaviors, such as making advances or displaying exhibitionism, may occur, often without the person realizing the social impact of their actions. Verbal or physical aggressiveness can also arise, especially during personal care tasks like bathing or dressing. Such behaviors can be challenging and even embarrassing for caregivers and loved ones. It's essential to recognize these actions as symptoms of the disease, rather than intentional misconduct. Strategies such as redirection, calm and reassuring communication, and making small environmental adjustments can help manage these behaviors effectively. 10. Repeating questions frequently. A common symptom of dementia is the repetition of questions within short time frames, even after receiving answers. This happens because dementia affects short-term memory, making it difficult for the person to retain new information. As a result, they may repeatedly ask the same question, sometimes unaware they've already asked. This can be frustrating or tiring for caregivers, but responding with patience, calm, and simple phrases can help. Providing written or visual reminders may also reduce the frequency of repetition and help the person feel more grounded in their surroundings. 11. Difficulty following conversations. Following conversations, particularly in group settings or noisy environments, can be challenging for someone with dementia. They may have difficulty processing what others are saying, lose track of the discussion, or struggle to find the right words to express themselves. This can lead to misunderstandings, frustration, or social withdrawal, as they might feel overwhelmed or embarrassed. To support communication, speak clearly and slowly, use shorter sentences, and give them time to process each point. Minimizing distractions and reducing background noise can also make conversations easier to follow. 12. Loss of time awareness. A diminished sense of time is another sign of dementia. The person may struggle to remember the day, month, or even year, and may have difficulty keeping track of important dates, such as birthdays or appointments. This temporal disorientation can disrupt their daily routines and cause confusion. In some cases, they might feel as if recent events happened long ago, or that past memories are current events. Using calendars, clocks, and maintaining a structured routine can help reinforce a sense of time and aid in keeping track of daily activities. 13. Difficulty making decisions. Decision-making can become challenging for someone with dementia, as they may find it hard to weigh options, evaluate pros and cons, or come to a conclusion. Simple choices, like deciding what to wear or what to eat, can feel overwhelming. For more complex decisions, such as those involving finances or health, the cognitive decline can lead to heightened anxiety and increased reliance on others. Offering clear and limited choices, and allowing extra time for decision-making, can support their independence and reduce feelings of stress. Causes of dementia. Dementia results from a range of conditions that damage brain cells, impacting memory, reasoning, and cognitive functions. Here are some common causes. Alzheimer's disease. The most common cause of dementia, Alzheimer's, involves abnormal protein accumulation in the brain, leading to neuron death and impaired brain function. Memory loss and difficulty in daily functioning are hallmark symptoms. Vascular dementia. Caused by reduced blood flow to the brain, vascular dementia may result from stroke, high blood pressure, or other circulatory issues. It often presents as difficulty with reasoning, planning, and attention. Lewy body dementia. Characterized by the buildup of alpha-synuclein protein, known as Lewy bodies, this form of dementia may cause memory problems, hallucinations, and motor symptoms similar to Parkinson's. Frontotemporal dementia. This type primarily affects the frontal and temporal lobes of the brain, which control personality and behavior. It may lead to impulsive behavior, inappropriate social conduct, and speech difficulties. Risk factors include advanced age, a family history of dementia, cardiovascular disease, and lifestyle factors such as poor diet, lack of exercise, and smoking. Preventative measures to reduce dementia risk. 1. Control blood sugar levels. Managing diabetes is essential for preventing dementia, as high blood sugar levels can damage blood vessels, impacting brain function over time. A balanced diet, regular physical activity, and medication as needed can help maintain stable blood sugar, reducing the risk of dementia. Managing diabetes also supports cardiovascular health, which is beneficial for brain health. 2. Quit smoking. Smoking significantly increases the risk of dementia, especially vascular dementia, as it damages blood vessels and restricts oxygen flow to the brain. Quitting smoking, even at older ages, provides long-term benefits for brain health. Resources like nicotine replacement therapies and behavioral support can assist with the quitting process, improving overall cognitive and physical well-being. 3. Manage stress levels. Chronic stress has a negative impact on brain health and can lead to memory issues and cognitive impairment. Practices such as meditation, deep breathing, and relaxation techniques can effectively lower stress. Maintaining healthy social relationships, engaging in hobbies, and finding a balance between personal and professional responsibilities are also essential for emotional and cognitive health. 4. Challenge your brain regularly. Engaging in mentally stimulating activities can help maintain cognitive health by strengthening neural connections and promoting brain plasticity. Activities like puzzles, word games, learning a new language, or playing a musical instrument are especially effective. Reading, writing, and engaging in intellectual discussions can also benefit brain health. For optimal results, choose enjoyable activities and vary the types of mental challenges you engage in to keep the brain active and resilient. 5. Engage in regular physical activity. Regular physical activity is vital for maintaining brain health and reducing dementia risk. Exercise enhances blood circulation, delivering more oxygen and essential nutrients to the brain. Additionally, physical activity stimulates the production of growth factors that support the health and survival of neurons, helping to preserve cognitive function. To achieve these benefits, it's recommended to engage in at least 150 minutes of moderate aerobic activity weekly, such as brisk walking, swimming, or dancing. Strength training exercises to build muscle and balance exercises to prevent falls are also highly beneficial. Finding activities that are enjoyable and tailored to individual fitness levels encourages long-term commitment to an active lifestyle. 6. Maintain an active social life. Staying socially active helps protect against dementia by stimulating the brain, promoting emotional well-being, and reducing the risk of social isolation, which can accelerate cognitive decline. Social engagement includes participating in group activities like book clubs, art classes, or volunteer work, which provide mental stimulation and foster meaningful connections. Spending quality time with family and friends also encourages regular communication, emotional support, and cognitive engagement, all of which contribute to brain health over the long term. 7. Prioritize quality sleep. Improving sleep quality is a critical step in dementia prevention, as good sleep is necessary for memory consolidation, toxin removal from the brain, and overall cognitive function. Establishing a consistent sleep routine, with regular times for going to bed and waking up, can improve sleep quality significantly. Creating a calming sleep environment, avoiding screens before bed, and practicing relaxation techniques like deep breathing or meditation can also aid sleep. Additionally, addressing sleep disorders, such as sleep apnea, is essential for restorative sleep that supports cognitive health. 8. Maintain a healthy weight. Achieving and maintaining a healthy weight can reduce dementia risk, as obesity, especially in middle age, is linked to cognitive decline. Excess weight negatively affects vascular health, increases inflammation, and may impair brain function. Adopting a balanced diet rich in fruits, vegetables, whole grains, and healthy fats, combined with regular physical activity, can help in reaching a healthy weight. Sustainable lifestyle changes, such as portion control and incorporating more whole foods into meals, are often more effective long-term strategies for managing weight and protecting brain health. 9. Develop cognitive reserve. Cognitive reserve refers to the brain's capacity to adapt and maintain cognitive function despite age-related changes or damage. Engaging in mentally stimulating activities throughout life, such as education, complex work tasks, and challenging hobbies, builds cognitive resilience. The greater the cognitive reserve, the better the brain can withstand challenges and retain function. Continuous learning, engaging in intellectually stimulating hobbies, and maintaining an active mind are excellent strategies for building cognitive reserve. 10. Adopt a brain-healthy diet. A nutritious diet is foundational to dementia prevention, as it supplies the brain with essential nutrients for optimal function. The Mediterranean diet, featuring fruits, vegetables, whole grains, fish, olive oil, and nuts, has been linked to a reduced risk of cognitive decline. Limiting processed foods, added sugars, and unhealthy fats also supports brain health. Foods rich in omega-3 fatty acids, such as salmon and walnuts, and antioxidants found in berries and leafy greens are especially beneficial, as they help protect brain cells from damage. 11. Manage blood pressure and cholesterol. Keeping blood pressure and cholesterol levels in check is crucial for brain health, as hypertension and high cholesterol can increase the risk of vascular dementia by damaging blood vessels and limiting oxygen flow to the brain. Lifestyle choices, including a healthy diet, regular exercise, and stress management, can help maintain these levels. In cases where lifestyle modifications are insufficient, doctors may prescribe medication to manage blood pressure and cholesterol. Dementia affects millions worldwide, making awareness, early recognition, and preventive measures essential. While a cure for dementia does not yet exist, adopting a proactive approach to brain health, including managing risk factors, engaging in mental stimulation, and maintaining a healthy lifestyle, can significantly reduce the risk of developing dementia. As research continues to evolve, new treatments and therapies bring hope for improved quality of life for those impacted by dementia. Prioritizing brain health throughout life is an invaluable investment for a brighter, cognitively healthier future. Don't forget to subscribe to the channel and turn on notifications to stay updated. Share your experiences or ask any questions in the comments below. Wishing you great health, wealth, and happiness.